This product is bound by a different set of regulations to medical aids, meaning that it has a more focused benefit structure and can be offered at a lower price point. This gives South Africans who have not been able to afford medical aid cover the opportunity to access private healthcare to some extent.
Hello and welcome. I'm Claire Mawisa, and this is Health of the Nation, a podcast series of conversations about a topic being hotly debated across the land: healthcare. Who has and doesn't have access to it, how expensive it is, and who should be paying for it. For our first conversation centered around the healthcare opportunity in South Africa, I am joined by Dr. Jessica Hamoy Blanco, Head of Product and Clinical Risk at Dis-Chem, and Dr. Vuyane, co-founder and CEO of the South Africa-based digital health company, Curo Medical. Welcome to you both. Now, both of you are medical doctors. Both of you understand the challenges in the healthcare sector from different angles. Dr. Jess, I want to start with you. What do you feel are some of the biggest challenges patients face right now in affording proper healthcare?
So in the private sector, we're seeing an inevitable fate play out, where the construct of medical aids is resulting in smaller risk pools and increasing costs. Medical aids are required by law to cover certain prescribed minimum benefits. So the intention here was to make sure that all members would be covered for certain conditions at all times, regardless of their scheme option. But this has ultimately driven up costs because covering these conditions for everybody is expensive, particularly given the reimbursement models for doctors, hospitals, and other providers. This means that even the lowest scheme options are unaffordable for many South Africans, and this results in an anti-selection effect. So what happens is that people who are more likely to utilize the benefits of their medical aid, so people who are older or less healthy, tend to remain on the product. And people who are younger and healthier are making the decision to forego medical aid because of other economic pressures and other priorities. So this results in a situation where majority of South Africans are unable to afford medical aid cover and ultimately reliant on the state. So then we have a situation where there is this fundamental mismatch in terms of supply and demand in the public sector. And the public sector is simply unable to keep up with the volume of patients that it is required to service. So you couple that with challenges around resource allocation, misuse of funds, inadequate infrastructure, and this leaves many South Africans struggling to afford healthcare even when they are seriously ill, not even mentioning, preventative care and screenings. And then something else that I just wanted to pick up on, you mentioned the word proper healthcare in your question. And I think this is a perception that a lot of people have, which is that, it's the quality of care in the public healthcare system that is the issue, and that you would access superior levels of skill and knowledge in the private sector. And I think this is a misconception in that it's more around, the lack of resources, overcrowded clinics, overcrowded hospitals that results in potentially a lower standard of care being received. And it is an unfortunate reality, but that's the reality that we face.
And how do you think Dis-Chem is addressing some of these issues?
So there is at the moment just a lack of any sort of middle ground between the private and public sector in terms of funding options. And traditionally speaking, there have been three options available to South Africans. So one is accessing the private sector through expensive medical aid cover. And often in this scenario, people are still paying out of pocket to some extent because of shortfalls or co-payments, depending on their scheme option. Secondly, people could access the private sector paying entirely out of pocket, which is only an opportunity for very few. And thirdly, you would have people completely dependent on the state. So Dis-Chem Health offers a fourth option in the form of its medical insurance product. This product is bound by a different set of regulations to medical aids, meaning that it has a more focused benefit structure and can be offered at a lower price point. This gives South Africans who have not been able to afford medical aid cover the opportunity to access private healthcare to some extent. So while the product does not include in-hospital cover, it allows South Africans to access primary and secondary healthcare within the private sector, which is a really significant development. The product also has preventative care and screenings as part of the benefits, which theoretically allows for conditions to be identified earlier and ultimately can reduce the cost of healthcare by allowing people to access treatment before serious and expensive complications come up. Dis-Chem Health also offers gap cover, which is available for consumers who are already on a medical aid. We know that medical aids don't cover the full cost of in-hospital treatment, and gap cover will cover the shortfall. So this helps to alleviate the financial burden on people who are already on medical aid. But I think what is really special about these products is the way that Dis-Chem has leveraged its assets to pass value back to the consumer. So Dis-Chem clinics offer nurse-led care and access to a virtual GP network at a very low price point. So including those benefits in the product has contributed to their competitive pricing. Dis-Chem also has its extra rewards program, which allows Dis-Chem Health policyholders to cover the cost of their premiums through savings on everyday essentials in their front shop. So these products really are aimed at making healthcare more accessible to South Africans.
Now, before we get your insights on this, Dr. Vuyane, for those who might not be familiar, what is Curo Medical?
Cure Medical is a South African digital health company. We specialize in remote patient monitoring. What that means is that we've got line of sight across the board for our patients, no matter where they are, whether it be at home, in facility care, whatever the case may be. We specialize in remote patient monitoring, and under that we've built, or rather we've created different clinical vehicles. In the market, we are known for a product called Hospital at Home. And this is where we provide an alternative to general ward admission. What that means is that when patients do require in-person care, specifically admission into the in-hospital facility, we can now treat patients from the comfort of their own home. We provide the technology to be able to monitor those patients in real time, so bringing clinical grade monitoring that would normally take place in the in-hospital facility to the patient's home. We've got dedicated clinical professionals who go in, doctors, nurses, clinical associates, who deliver the care that would ordinarily be provided in traditional brick and mortar facilities. We do more. Unlike in the traditional in-hospital facilities, again, where patients are monitored every 4 to 6 hours, we capture the vital sign information. So this is physiological data that tells about the patient's physical health minute by minute. We transmit this to a 24-hour command center that is run by doctors so that patients are always in sight. If we pick up that the patient is running into trouble, we can then trigger our rapid response protocols that would range anything from dispatching any of our emergency medical services partners that are part of our network, or dispatching one of our clinical professionals, or providing care to the patient as and when they need that. And we do more. We are able to provide things like laboratory investigations from the comfort of the patient's home. We're then also able to, if a patient requires additional investigations such as radiology, by that I mean X-rays, CT scans, and an ad, fully covered by the medical aid, we facilitate transport of those patients to have those investigations done in facility and return those patients back into the comfort of their home. What this has done for us is that we've been able to focus on all the essential elements of in-hospital care and bring those to the patient's environment, which means that we remove the expensive part of healthcare, which is actually the bed and breakfast cost, right? And only focus on packaging a basket of services that actually make the patient better. And one more thing we do is that we try and unblind the doctor to what is happening to the patient while they're at home. So what that means is that the patient's doctor actually gets insights. So they know at any given time how the patient is doing, how they're progressing, the care that is being delivered in real time, right? And for that, the doctors are reimbursed by the schemes at the same rate as they would be if they were seeing the patients in hospital, which means there isn't a disincentive in treating the patients out of traditional brick and mortar facilities. So today's doctors only have to worry about where can they deliver the best care for the patient, and we take care of the rest.
Mm-hmm. And we do more. I won't forget that. What moved you to start a company that focuses on healthcare in the patient's own home? What was the motivation?
Well, for the longest time, we've been trapped in this vicious cycle of like rising care costs and declining quality of care, right? The reality is that our problem isn't just a financial one, right? Is that we actually are not getting real value for what we pay for from a healthcare perspective. And a big driver of the rising cost of care is actually hospitalization. There has been so much data that's been published for decades that has demonstrated that the home is not only a safe environment for delivery care, but patients recover faster, right? The patient experience with care is so much better, but also there's a significant shift in dynamic from a care perspective, because if you think about the kind of the power dynamic in the in-hospital space, patients often cannot advocate for themselves. Well, when you're in your home, there's a shift in that dynamic.
Home ground advantage.
Completely, right? And what's interesting for us is that best, and then at a lower cost, right? And so when we talk about something called value-based care, we talk about how do we deliver good quality care where we enhance the experience and the kind of care that the patient receives at a lower cost. But one more thing for us was COVID, right? The one thing that COVID taught all of us is that no matter how much money you have, you cannot buy your way into healthcare, right? The only thing that is guaranteed is your hospital bed. So we were looking after patients in the comfort of their own homes when hospitals were turning people away, right? Where hospitals couldn't actually deliver the kind of care that they would have ordinarily delivered had those patients been admitted, right? And so we managed to save lives, decompress busy facilities, but most importantly, do that in a way that is also cost effective.
I mean, this to me is something that I find so exciting in terms of the line of thinking. And I mean, what Cura has done in the tertiary care space, this whole concept of taking this expensive kind of level of care and essentially pulling it forward, which is the same way that Dis-Chem is thinking about the primary care space. We know that there are many inappropriate referrals. There's so much cost that gets driven up by people accessing GPs where they could have been treated by a nurse, or accessing specialists where they could have been treated by a GP. And I think this idea of pulling healthcare forward to a more affordable level is a concept that I'm really excited to see play out in the space.
Incredible. Cura Medical seems to have this innovation that addresses healthcare in this country with an intriguing new angle. What are you covering that hasn't been covered before? What can you do that other spaces can't do?
Look, one of the things that I'm really keen and I would like to commend Dis-Chem is the innovation from a funding space. And I think that's something that's been limited for a very, very long time. Another gap has been innovation from a provider perspective, right? And that's where we come in, right? How do you deliver care more efficiently? How do you deliver care more cost effectively? How do you deliver care in a way that helps us actually increase the funds that are available so that the people, particularly those in the last mile of health, can also benefit from whatever resources that we have? The other thing for us that is particularly important is that we have major constraints as a country. We don't have enough healthcare professionals to deliver care. We don't have the finances to be able to deliver that. We don't have access to a whole lot of resources. So we need to find ways to do more with less. And I think that's one of the things that we've been able to do and say, look at where are the efficiencies within a healthcare perspective? And the greatest efficiencies actually lie within the in-hospital environment, right? In terms of if we are able to decompress those facilities and treating the right patient at the right place, at the right cost for the right duration, you now end up having enough resources, both financial and human capital, to deliver care at the most appropriate places. And I think, for example, what Dis-Chem has done from a primary healthcare perspective in ensuring that patients get, a nurse when they need to consult with a nurse, bring in a doctor when they need to provide doctor, where patients don't incur unnecessary expenses. If I'm already in a mall and I'm in a chemist and I can get the consultation, right? You're able to access that care. That is how we change, and I think we transform our healthcare system.
Phenomenal. Dr. Jess, this brings me back to Dis-Chem's medical insurance offering. Can you tell us a little bit about how it works?
Sure. So medical insurance is a risk-based product that has a much more focused benefit structure compared to medical aids. So medical aids and medical insurance are both governed by the Council for Medical Schemes, but medical insurance products are exempt from certain provisions of the Medical Schemes Act. So most notably is the fact that medical insurance products are not obliged to cover the same prescribed minimum benefits that medical schemes are. And this allows the product to be offered at a much lower price point. So while medical schemes are obligated to cover in-hospital care, medical insurance is not. So medical insurance covers day-to-day benefits such as nurse visits, GPs, specialist visits, pathology, medication. So it's primarily in that primary and secondary care space. Medical schemes are also obligated to offer the same premium to all members on the same plan, irrespective of how old they are or what their health status is. Whereas medical insurance is able to differentiate pricing based on some of those factors.
And what has the uptake been like?
It's been really interesting in that, it's been a time where the market has still kind of had to wrap their head around what medical insurance actually is. So I think our team's done an exceptional job of educating the market while also selling into it. And this has resulted in a steadily growing policyholder base. We've also received very positive responses from corporates who are also interested in subsidizing medical insurance cover for their staff. So we do expect to see continuing growth in both our corporate and retail books as people become more familiar with the product and the value that it can bring.
And what do you think this will have in terms of impact on the industry?
I mean, Claire, these products were designed to make private healthcare more accessible and more affordable to more South Africans. And I think we are starting to see that take shape. So what the medical insurance product could do is to give South Africans the opportunity to have some level of funding where alternatively they would have had nothing. And it gives people the opportunity to access private healthcare to some extent. And we can sort of pull people out of this complete dependency on the state. So that will hopefully go some way to address that mismatch in supply and demand that I mentioned earlier and alleviate the burden on the public sector. It will also be very interesting to see the way that medical aid members react to an alternative funding product in the market. So I think where people are easily able to afford medical aid cover, it is sensible for them to remain on those products. But for people who are under big economic pressure and potentially considering cancelling their medical aid product, this does offer a feasible option.
Now, Dr. Vuyane, are there any models or examples that stand out anywhere else in the world that you could share with us?
Absolutely. The idea of treating patients at home is not new, right? I mean, we've been treating patients for a long time. In fact, the treatment of patients and delivery of care at home has been around since, very early stages. In fact, we introduced hospitals as an efficient way of delivering care, right? And it was meant to be a cost-effective way of delivering care to poor people, right? The reality, however, is that with advancement of technology, it became increasingly expensive and unaffordable that even poor people could not have access to hospitals. But the issues around quality and safety have been settled for a very long time. And this is one of the reasons why, if you look at other markets, whether it's Japan or Taiwan or Australia or India, in the United States, the NHS, the way in which the NHS is now going to solve this problem is actually by delivering care at home. And so what we're seeing here is actually not experimental on our people. It's a model whose time has come. In fact, the next decade or rather the next frontier of healthcare is really primed for disruption by what we call hospital at home and the ability to deliver care. And Cure Medical is pioneering that within the African context. I mean, we are building the largest virtual hospital on the continent, right? We already have 90% of the medical schemes in South Africa who fully reimburse the solution and across all plans. We do not discriminate what plan. You could be on the lowest plan. You could be on any one of Dis-Chem's plan. And we hope that once they get to a point where they feel that they cannot deliver care, we still provide a cost-effective, but most importantly, a better version, a better mechanism delivering in-hospital care for some of those patients.
What motivated you to start a company that focuses on healthcare in the patient's own home?
I guess one of the things that inspire most of us to get into healthcare is our own personal stories. I'm from Khayelitsha, a massive township in Cape Town. I had two very sickly parents. My dad succumbed to complications of diabetes. He couldn't access dialysis when he had renal failure. My mom, on the eve of my own matric exam, suffered a stroke. And then she was able to, receive care at Groote Hospital. After timely medication, she managed to recover quickly. So I had an experience of a healthcare system that couldn't save my dad, but I could see that with timely intervention, it could save my mom. it inspired me to get into medicine, but very quickly realized that even our public healthcare system has its own limitations, and that the private sector actually has an obligation to shoulder some of the burden that is carried by the public sector. And it's on this basis that we then need to come up with innovative solution that addresses some of these needs. The reality about healthcare is that it's just too big a problem to solve alone. The public sector, with its resources, has demonstrated that it can't. But the reality is that the private sector is also incapable of addressing some of these solutions alone, and therefore requires all of us to be able to find ways to work together. And I think for us, some of the work that we're trying to do, even with Dis-Chem, is a demonstration, and if anything, we're trying to set an example of what can be achieved through a collaborative effort. We've inherited a healthcare system that is plagued with all sorts of ills. But we get to decide what that looks like going forward, not just for ourselves, but for our people and for generations to come. And the solution for that is, how do we collaborate with impact? And I think after that, we were clear that where we can find efficiencies within healthcare, whether it's from a resource perspective in how we utilize our healthcare personnel, whether it's where we treat our patients, hospitals versus being able to deliver care at home, whether we're able to, introduce technology so that we can achieve scale, and then take all the savings that come from there and redirect them to other parts of healthcare. That for us is what inspired us to basically build Cure Medical. And COVID-19 created, I guess, an environment to be able to test our hypothesis. And when we saw some of the limitations and our healthcare system buckling under incredible pressure, our healthcare professionals tripping over themselves, not being able to reach patients, and us losing lives in the thousands, our case was made that we are actually able to deliver care. And I think it's not enough. We need more. And this is one of the reasons why we're collaborating for impact.
Are there any models that exist anywhere else in the world that stand out for you that you could share with us?
Completely. I think we've seen a shift in care being delivered at home. For example, in Australia, hospital at home is offered directly by government, reimbursed at the same level as patients being seen in the in-hospital without savings, because the argument is that where value is created, value is rewarded. The US is moving in that direction. The NHS is moving in that direction, fully reimbursing and delivering care at home. If people think that this is just for the preserve of kind of developed countries, in India, over 5 million people have access to this, right? The one place that was lagging behind was South Africa, and I guess the continent more generally, right? And I think that one of the things that we're trying to do is to build the largest virtual hospital in Africa, because then in areas, particularly countries where we don't have the funds to erect massive infrastructure and build hospitals, we could then potentially leverage what we already have, which is the patient's home, bringing technology and healthcare personnel to ensure that they receive the care that they need at a fraction of the cost.
Dr. Jess, any final words on why this partnership is so important and works so well?
Well, I think this collaboration really highlights the fact that we can't have a one-size-fits-all approach to addressing the issues in our healthcare system. We need to be open to developing tailored solutions that will really suit the everyday South African.
Well, maybe this fascinating conversation we've just had might play a small part in sparking a discussion in your very own organization. Thank you so much, Dr. Jessica Hamoy Blanco, Head of Product and Clinical Risk at Dis-Chem, and Dr. Vuyane Mhlomi, co-founder and CEO of the South Africa-based digital health company Cure Medical. Let's keep the conversation going. This has been episode 1 of Health of the Nation. Remember, you can catch the entire series wherever you get your favorite podcasts. Until then, yours in good health. Goodbye.